in Middle Tennessee?
Well, one thing, of course, is that we want to continue to grow. We want to see more units developed, especially in the churches. We want to get more of the fraternities and sororities involved in supporting scouting, because, see, we need leadership. You can't really have scouting programs unless you can attract people who are willing to give their time to provide leadership. And we've spent a lot of time, especially in the last year, saying, where are we going to get this leadership? So we're now looking to the churches, we're looking to the fraternities, the sororities, to the ministerial council and others, and they're responding.
They're responding from a positive point of view.
They're responding in terms of people volunteering to, I think 56 new volunteers were added last year, adult volunteers, and people willing to set up scouting units at the Cub Scout level, the Boy Scout level. We started an Explorer unit, for example, at Hubbard Hospital over at Meharry. So I think the task force has been very effective. I've enjoyed working with them.
Well, I think you're to be commended for that kind of activity. But more important, I think, I'd like to say something about fundraising at Meharry, since after all, I think that is your major responsibility. What kind of activity are you involved in now at Meharry?
Well, beginning back in July of '82, when I started as president at Meharry, we developed the so-called Plan for Academic Renewal, which is both an academic and a financial plan. Basically, it was a plan that required us to raise $33 million over a 5-year period to fund faculty augmentation, to fund the development of research centers of excellence, to increase the support for students, financial aid, and to upgrade our library and related facilities. So 4 areas that are very important for Meharry presently and in the future are funded by this Plan for Academic Renewal. So we developed the plan. I think we wrote it up in such a way that people can understand very clearly what we're trying to do at Meharry. And we've taken that plan to foundations, corporations, and individuals. And again, we've been very fortunate. We've just completed the 4th year of that 5-year plan, and we're into the last year. But as of June 30th, which ended the 4th year, we had raised over $32 million.
So you're right on target.
Yeah, we're a little ahead of schedule, and I say that reluctantly, though, because in some ways you might say that we didn't set the goal high enough, because I think certainly we will go over the goal. And the needs are certainly there as far as the programs at Meharry are concerned. So I feel very good about the response that we've received from foundations and corporations and individuals. For example, just this past year, something very interesting happened. We learned that 2 of our alumni who had passed in the last 3 years had left the institution bequest in excess of $1 million. If that kind of thing really catches on among our alumni, the future of Meharry will certainly be more secure.
Very good. So Meharry is continuing to raise funds in various areas.
Yes, fundraising is very important for Meharry because we are a private school. We receive federal funding, but it's competitive funding for the most part, and we receive some state support for categorical programs, but we are a private school, so we rely upon private fundraising significantly for our programs.
And I will say something else about fundraising later on, Dr. Satcher, but I'd like to also cover research at Meharry, some of the things that you're doing in your research activities.
Yes. Well, let me say that I think research is very important. There are a lot of very important questions to be answered as far as health and health care are concerned. You probably remember the report that came out in October 1985 from then Secretary Heckler of the Department of Health and Human Services, which showed, among other things, that there is a significant gap in the health status between minorities and non-minorities in this country. For example, the report showed that infant mortality is twice as great among blacks as among whites. It showed that the life expectancy for blacks is 6 years less than it is for whites. It showed an increased risk for cardiovascular diseases and cancer and several other things. Our feeling is that there are a lot of things that need to be done to impact upon that problem. Among them is research. We feel that research is very important, and so we have major research efforts now going, for example, in nutrition. Last year, the General Foods Corporation gave us a $1.7 million grant to develop a center of nutrition research. We have now brought on a director for that center and are developing that program. When you think of the role of nutrition in things like cancer and hypertension, then you realize how important that is, that we have some really solid research programs in the area of nutrition. Tropical diseases. We are interested in problems in the third world, in Africa, in the Caribbean, and other places. We have a very strong research program developing in tropical disease. We have some outstanding faculty members in that area, looking at problems like schistosomiasis, like malaria, and problems that we don't hear much about in this country, but problems that are leading causes of death in other countries. And therefore, we feel that that area of research is also important.
Very good. Dr. Thatcher, we're going to have to take a break here for our Black Pulse profile. And we'll talk about, when we come back, we'll talk about research, and we'll probably say something else about fundraising activity and some of the other things that are important.
Very good.